All right. Good evening, everybody. I'm Dr. Jeremy Maxwell, owner of the Wellness Way Columbia, and welcome to Hope for Your Hormones. So also with me tonight, we have Dr. James and Dr. Jessica, and combined between the three of us, we have 30 years of clinical experience. And so to put all that together, I can with confidence say you're in the right place tonight, because my goal is to give you hope, not just for your hormones again, but for whatever the condition may be, whether it's a prostate issue, whether it's diabetes, cancer. I want to give a different perspective about how to do health differently. And so when we're talking about the Wellness Way, one of the newest things that we've kind of released as a company is, well, I guess what we call our elevator pitch. And so it is that we are a network of restoration clinics that think and act differently to solve health challenges that others can't. And so that's what excites me the most about being a part of the Wellness Way, is we've been able to seek and help those with major challenges where they've been all over the place and they don't know what to do, and they come here, they find hope again, we dig a little deep, come up with a plan, and get them back on track and restore normal health again. So I'm excited to share this message. Again, this will be heavily female oriented tonight. So those of you who might be males on the webinar tonight and in-house, that's okay. I'm going to adapt it a little bit for you guys as well, because guess what? You guys have hormones just like females do. Just because we're different, they influence us a little bit differently. And I want to make hopefully some headway for the guys tonight to learn how to live with females. Did you guys know that you're married to 4 different women? If you are married, 1 different one every week. So I'm going to give you some confidence tonight to learn how to navigate that, and it'll be to your advantage. For some of you tonight, ladies, I think you can probably relate to this. Your story may be one that started early in your teens when you first got your period. Maybe you were starting at the beginning of the month in the school year, where you were missing a day of school almost every month, or maybe 2 days. Maybe that continued on into high school, where it was affecting your sports, your ability to perform, even at an academic level. These can be very debilitating when you have no idea what's going on. And then on into college, I see that with many of the college age ladies that we take care of now, they're still years into their cycle with no answers and frustration, and still missing classes and days of work because of the pain that they're going through. Fast forward now, some of those situations have turned into metabolic issues or weight issues. We deal with a lot of individuals that seem to be eating healthy, seem to be doing the right things, and yet they can't lose weight. They find out that they've got polycystic ovarian syndrome, so they get a lot of those painful cramps each month and cysts. So what do doctors do? They give them medication. So there's drugs like metformin or birth control that do help the symptoms oftentimes, but they don't really change or improve the function. And tonight we're going to kind of walk you through how they really create a lot of interruption in normal hormonal processes. And then one of the most frustrating cases that we see more and more now are infertility. So a lot of these painful cramps, these irregular periods through the early teens now are turning into just broken hearts, where couples are not able to have children because of just the drugs they've been on and the lack of answers and information. And it is a growing problem. And as you guys are going to hear tonight, just because things are common does not mean they're normal. There's a lot of conditions like that. And we see when it comes to periods or menstruation for ladies, it's a very common thing that abnormal, periods are happening. It's becoming very common for men that prostate issues are there, but it's not just a normal part of the aging process like we're told. So hopefully tonight I'll challenge each of us to think a little differently when it comes to those conditions. Now, most ladies, when you kind of look at the time span of life, we look at hormones as if this is just the normal thing that should happen without any problem. We're going to be conceived, we're going to be born, we go through puberty, we get married, go through regular adulthood, have some kids, we get menopause, and we're like, no more period ever again. It's like you're almost living for menopause to come, even though that monthly cycle is a very normal process that should happen. But the reality is it's more like this these days. Now, instead of some normal conception happening, it's happening in vitro, or it's happening by manipulation. And then instead of just regular vaginal births, there's a lot of interruption now. They're being pulled out, yanked out, planned cesareans. It's like everything has to be on either the doctor's time or the patient's time. Nothing just kind of naturally happens like it was designed to. And then puberty, which kind of used to be a rite of passage, is now almost something feared on a regular basis, because I can't tell you how many teenage girls we see. Probably 6 out of 8 that come in here are on birth control. And it just blows my mind. And they've been on it since they were 12, 13, 14 years of age. And they'll be on that till all of a sudden they're either deciding to have a baby, accidentally are going to have a baby, and then they can't, because they've been interrupting that process for years. And then, again, we talked about it. When couples get together, they deal with a lot of heartache and stress, because whether it's the female or the male, stressors, drugs, all these different medications interrupt that normal process and make it very challenging to have a baby. And some of you watching, this may be your story again. You maybe have been trying for a really long time, and hopefully tonight we'll be able to shed some light on things and give you new hope to get restored to normal. And then we have the bad boobie parties and the bad uterus parties, where people are getting them cut, women are getting their breasts cut off, uteruses cut out, because again, very common thing, they think if I cut it out now, even if they don't have cancer, maybe they have the BRCA gene, it's like that's going to prevent something. Well, cancer is very, shall I say, resilient. It will find a way to go find some other tissue. So just to remove something does not mean you're going to be free from getting cancer. Where did things go wrong for you? You might be on here asking yourself that question already, and that's why you're here. Like, nobody's giving you any answers as to how did I even get here. Now, this was fairly new to me about 3.5 years ago, as I began to dive a little bit deeper into just the health journey in general for our practice, trying to find answers for individuals like yourself when it comes to fertility and hormones. We're trying to find triggers. What are things that have interrupted this normal process? And believe it or not, like male or female, you've been influenced by your environment 3 generations ago. So this is what's really cool to me, but very fascinating, is that when each of us were in our mother's ovary as a primordial follicle, so it hasn't been a cell that's matured yet, you're in her ovaries as an infant while she's in her mother's womb being developed. So even your grandmother could have had an influence into your development and ability to just be normal. Smoking was big a long time ago when you were pregnant. It was known, people didn't really know a lot yet. Maybe they were drinking. Maybe they were factory workers. All of those things could still influence 3 generations. And that's what's so bizarre to me, is we think, well, we're only the age we are now. But then you think about the fact that you were already in existence really in your mother's ovary when she was just a baby. Pretty cool, huh? But pretty scary to see how many years of influence can impact your development. So there's a lot of things that do influence that. Now, we spend a lot of time actually talking about birth, especially Dr. Jessica. She loves working with kids and pregnant moms, because this is really where the first trauma to the spine can begin. Whether it's an immediate cesarean section or emergency C-section that has to take place, or whether it's vacuum extraction to pull that out, or even just a good, healthy vaginal birth, that's a lot of trauma coming through the chute. And if the baby's not positioned right, that puts a lot of strain on that upper neck, which interrupts nerve flow. And so one of our main jobs as chiropractors is to make sure there's no interference, nothing blocking, that communication from the head to the rest of the body. Just like an air return, right? If air is being blocked, guess what? You're not going to get air back and through to clean it and put it back for people to breathe healthy air. One of the scary things is just to see the increase in cesarean sections. And, tonight we're not going to spend a lot of detail about just the benefits of a vaginal birth versus cesarean. But again, when you start to stray away from that normal process, there is definitely going to be an interruption in what normal exposures. And so, when we talk a lot today about, whether it's COVID or anything else, exposure is important. That's what really helps develop a normal response to our immune system. And this is really where many children today are missing out on their first exposure to bacteria and viruses in that environment, because if they don't actually pass through the vaginal canal, you miss out on mom's microbiome. So they end up, they don't do that. Now they're exposed first to whatever's in the hospital coming out this direction. So that, they kind of get off on the wrong foot right off the bat. And I don't know about you guys, but anybody else kind of go to Walmart, Target, whatever the store is, and you just people watch? Like growing up in Northern California, I would seriously, my friends and I would just drive to Berkeley and sit on the streets and just watch people. It was very fascinating to me. But now I find myself doing it, wishing I could just go tap somebody and say, can I help you? I have answers to help, especially when I see the number of children that are dealing with obesity. I mean, when we were growing up, we hardly saw overweight children. I mean, we were always playing in the streets, riding bikes. We were out till dark. And now, as I put it, I see too many overweight kids, and they're all dragging bags of Skittles and sodas around. So it's no wonder that we're seeing a change in the hormones, not only in males, but females. They're getting their periods earlier. Hormones are laced in everything, to hair products, to makeup, to foods, plastics, you name it. We're inundated by it, and it's changing and altering our women and our young girls. So we talked about it earlier. It's no wonder we have a lot of abnormal cycles, and there's a lot of reasons for that. We see now pretty much 30% of women have irregular periods. 80% have some type of pain or problem beforehand. So common, again, is not normal. And that's one thing we want to really try to change, whether we're talking about hormones or immune problems or the nerve system. I don't really know how and where, but along the way, we just decided that, well, if all these people are having it, it must just be a normal part of aging. I strongly disagree. That is not the case. Because I always go to this. It's like, who knows a 70-year-old that looks like they're 50? And who has seen a 40-year-old that looks like they're 80? I've seen them this week in the office. It's just like, I had a new patient recently that I would have put money on it. He had me by 10 or 15 years. I had him by 10 or 15 years. So our things that we do lifestyle-wise play a big role in our normal function. So this leads perfect. I mean, how are we interrupting normal? Chemistry. Birth control being one of the biggest ones for our ladies. And as we were preparing tonight, we saw an array of different issues that many of you were struggling with, whether it was weight gain, moodiness, to put it on the light side. That was not how it was described. Usually, I think the B word was used. They're not being nice to their kids, their husbands, whatever the case is. I know you guys can relate to this. And I hope, again, tonight, you'll see how these chemicals interrupt that process. I mean, 62% of women of reproductive age are on hormonal birth control. That is a huge amount of women changing their hormone production. So we know that these pills are a known endocrine disruptor. So anytime you take outside hormonal influence and put it into the body, that will have a negative side effect on how things work normally. And unfortunately, what are most women told about birth control? One, there really are no bad side effects. It's going to help balance your hormones. It'll help regulate your period and cycle. I mean, you name it, we've heard it all. And yet we see the women come in, they can't get pregnant. They can't have a cycle. Their gut health is a wreck. Their skin is a wreck. It's like you go and you start reading all of the side effects in the small print that the doctors never show you, and you go, oh my gosh, it's all right here. And the drug companies have let everybody know that, but they never read the inserts because, one, they're so small print and they're a mile long. The birth control history goes back a ways. I don't want to belabor too much of that, but the bottom line is this right here. When additional hormone is added, so basically exogenous hormones or fake hormones from the outside coming in, that's going to alter pituitary function. So think of it kind of like this big feedback mechanism. We've got the pituitary talking to whether it's female ovaries, male testes, and then back up to the brain. And it's just saying, hey, we need to make more or don't make any more. And there's just this constant feedback to that. So when you put in something that's not normally in the body, that's going to mess with this. And then you throw in trauma and toxins and actual stress. Now we've created a really bad storm in the body. And eventually that leads to problems more than just hormone. That can lead to immune deficiencies, cancers, many other situations. And we know that these are endocrine disruptors. I mean, the National Institute of Health has things on it. The EPA has papers about it. I mean, it's in our food, it's in our plasticware, it's in all these different things that we use every day that interrupt that process. But most of us don't ever think about what we rub on our hair or under our arms or what we drink out of, how our food is stored. So just a little anatomy and history, not history, but production wise. I mean, all a hormone is a messenger. It's a protein messenger that's carrying information. It's the way our body communicates to itself. And so when we start putting these synthetic things in, now you guys see how that can communicate some misinformation to the cells and disrupt that normal process. We also know that endocrine disruptors create malformations. I mean, we see a lot of miscarriages. We see a lot of birth defects these days. It's going to affect reproduction, increase your cancer risks. And how are we doing for that these days? Over the last 50 years, we've spent more money than any other country trying to cure cancer. And have we made any progress? Nope. We got a lot more ribbons, that's for sure. And more pink socks, pink shoes, pink shirts. I'm all for awareness, but their idea of not really getting cancer is early detection. To me, that doesn't make any sense. So you're telling women and men, hey, go ahead and get it to make sure you're on a path to not getting cancer. That really is the cure, not waiting for it and then trying to annihilate your body. So for those of you who are watching, maybe this list looks familiar to you. Some of those hormonal issues show up as polycystic ovarian syndrome, endometriosis, where you're basically not sloughing off that endometrial lining, or you're just creating a lot of excess tissue and scar tissue in and or around the uterine tissue there. Premenstrual syndrome, lack of sex drive. I mean, that is probably the number one, well, percentage-wise, that's one of the biggest complaints that most females will have because of that hormone disruption. So, when we look at the body as a whole, and I think of couples, it's like, okay, I mean, this goes back thousands of years that the man usually wants it more than the female. But that's just the way we've kind of been made. But then you couple that with disruption, now it creates relationship stress. It may not be that you don't know how to conflict resolution or communicate, but what if there's an actual just physical issue that's creating stress in the relationship? And if you don't have the right information and tools, it's going to be hard to restore that. Or I know men who would be like, well, man, I wish my wife would chase me as much as I want to chase her. Well, if she is, as cool as that might be to us, I'm sorry, ladies or men, but your wife or your girlfriend is sick because they're not supposed to have a drive 30 days out of the month. So again, those are all things that we're going to take into consideration as we test and figure out how the body is adapting or not adapting. And the really frightening thing to me is this: 1 in 6 couples are dealing with infertility. And then when you look at the statistics of like autoimmune disease, I mean, the age frame right now that's most affected by autoimmune, which is actually killing our females, is 20 to 40. I mean, that is the ripe age for birthing babies and, you know, growing our population. Which we won't get into that topic tonight, but, you know, we do have to replicate as a species to keep things going. So when you've got 1 in 6 couples dealing with that, you've got 20 to 40-year-old females who are in the biggest population of dying from autoimmune disease and then taking Humira, which is a huge immune suppressing drug. Is it any wonder, you guys, that we have the problems that we do today when it comes to health? I mean, we're chronically sick like no other country. So ladies, if you don't know your cycle real well, and sorry guys, you're going to get to learn a little anatomy lesson tonight, but it's to your advantage, all right? So again, I want you to be successful while you're married to the 4 different women every month. So this down here is just kind of like, here's what the uterine tissue is doing from day 1 to about day 30. Here's kind of what the estrogen and progesterones are doing. Here's some other hormones from the brain that are telling these hormones to be produced. And I bet many of you didn't realize, if I were to ask, where is estrogen and progesterone made, what would you say? Most people would say it's made in the ovaries. But it's actually kind of made there, but it actually comes from the actual maturation of the follicle. So as that follicle matures and gets prepared for Mr. Spermie to come meet up with it, that's where estrogen comes from. And then if they don't meet up, there's the degradation of what they call the corpus luteum. That's where your progesterone comes from. Now that all happens right there within the ovary, but the ovary itself does not really produce the hormone. It comes from the maturation of those cells. It's kind of a cool deal. So ladies and men, it's normal for your lady to fluctuate each week. So they're not crazy. Even when they're working normal, there are some things that happen physiologically in their body that do make them think weird things sometimes. I mean, there's times during the week or in the month when I just need to be super duper nice and loving to my wife because she has got some really, really messed up thoughts going on in there. She's like, I don't have them on purpose, but that's my chemistry right now. So I make sure that there's lots of hugs sometimes in that time frame, but lots of building up and chocolate. Now, this is one of my favorite pictures of all time. So what we've got on the screen here is your sex steroid hormone chart. And really what it is it's a picture of what's going on in your liver. So what do you see highlighted in yellow? And you guys can speak right here. I'm more than happy to hear voices. Cholesterol, that's right. Now, when we think of cholesterol today, do you have a positive outlook or a negative outlook when you hear that word? Negative, yeah. Because what do we hear? Cholesterol is bad for you. It's going to give you heart disease. Well, here's where the Wellness Way approach is very unique. So when people, tell me, well, cholesterol is bad, right? Well, there's good and bad. Then I ask them this. Since when did your liver start making bad things for your heart? Doesn't. Never does. The body never makes mistakes. So all cholesterol, LDLs, HDLs, VLDLs, they're all necessary for normal function. But when there's things like inflammation, stress, outside chemicals and drugs coming in the body that begin to put stress on the liver, it has to adapt to an environmental change. So if there's an injury, so let's say we were out golfing and we hit a pothole and we sprained our ankle, what's going to happen? There's an inflammatory response. That's a good inflammation, and it's normal. Guess what goes up? If we were to take your blood, cholesterol would go up because that's one of the main components to inflammation. This is also the main component to making every single one of those steroid hormones. So if that's true, what do you think would happen if you were to take which drug? So you think cholesterol, which drug comes to mind? Statins. or Lipitor. So Lipitor used to be, for like 50 years, the #1 sold drug in the world. And it interrupted a hormone or an enzymatic pathway in the liver so that you wouldn't make cholesterol. So yes, the drug was designed to lower cholesterol. Undisputed, the science shows that. But the science also shows that too low of cholesterol, you increase your risk for death. Quite the opposite of what they teach us. So they say if you lower cholesterol, you decrease your risk for heart disease. What else do you think would decrease if you don't have enough cholesterol? How are your hormones going to be? High or low? They're going to be too low. That's right. So you interrupt this pathway, and now you've interrupted everything downstream. Again, is it any wonder we have the problems that we have today? Now, do you guys know anybody who takes a statin drug? So my question, if you guys are listening really good, does anybody know a guy who takes a statin drug so it lowers his cholesterol, which decreases his testosterone? Have you ever seen any one of those guys driven with high energy and ready to get up and say hello to his wife? Or shall I say salute her? Not one bit. They're usually not very happy. They're very low drive because they don't have any testosterone. The very thing they need to make it is being told to not be made because they're on that statin drug. And it's the same thing for women. Now, typically, it's not usual to see a lot of women of childbearing age on this because it's kind of contraindicated. You tend to see them get on it post-menopausal. I'm not saying it doesn't happen, but you don't typically see women on that. Now, here's where it can affect women the most. So any of you who are watching ever missed your cycle before and thought, oh crap, I'm pregnant? Or it's been 5 months now. Why have I still not had a period, but I'm not pregnant? Well, it has a lot to do with stress. So how many of you knew that when you're under a lot of stress, obviously your adrenal glands are going to be under the mindset of, I got to keep up with cortisol, got to make more. In order to keep up with that response, you got to convert progesterone to cortisol. Anybody ever heard of the progesterone steal or pregnenolone steal? That's exactly what's happening. In order to keep up with your stress, you have to convert that hormone to cortisol. And if you don't have progesterone, guess what? You're not going to prepare that endometrial lining for sloughage so that you can have your period. Therefore, it just thickens and thickens and you don't get rid of it. So that can be very devastating to the female. So this chart, it's very important that we keep in mind what's going on upstream, because if that stays pretty normal, everything downstream will be in pretty good shape. How do you see why men and women deal with stress differently? Women, by design, they struggle a little more with it to keep up with this cortisol response. Guys deal with cortisol a lot differently. So again, is it no wonder that hormonal problems are at an all-time high? I like this slide because most people, when they come, they want to know, all right, we know what you do is pretty good. What's it going to cost? Right? Like, coming to look at my roof. I'm going to want to know what's it going to cost me. What did those people not tell me when I bought that house? That's what's going in my mind right now. But everybody wants to know. And when I look at this was eye-opening to me. And I know, again, there's ladies, couples, you guys have been through fertility issues. You're going to relate to this. But there's a lot of different ways that you can get pregnant through manipulation or these IVF treatments, IUIs. But literally, the average cost for a success story to get pregnant through IVF is $48,000. 27% success rate. That is low. Okay. Typically, you're going to spend about $6,000 in meds. I'm pretty sure that's ridiculously low. And then you've got different forms at which, IVF DE is the most invasive and most expensive. So you're talking $72,000 to manipulate chemistry, to create, the sperm and the egg to come together, implant it. And by this phase, I'm already like, listen, you guys, are you really paying attention to what's going on? The body's leaving clues and we're not listening. If you can't get pregnant and house it in the environment that it was designed to, how in the world can you manipulate the physiology, force it into that environment, and then expect it to be normal if it even makes it all the way? That's like me flying down to Florida, grabbing a bunch of fruit trees, bringing them back to Missouri, and then really being upset come spring when I don't have oranges, limes, and lemons. Like, this environment is not conducive to growing that. And so it's frustrating to me to watch couples spend that kind of money when they're really, the doctors, in my opinion, it's their job to be letting the female know, listen, your body may not be the right environment for this. But hey, $72,000, they go along. That's just for one possibility. I mean, I know people have spent $300,000. And I think that's for manipulation. That's for doing nothing to change your environment. So then we get to the wellness way. And I said, Clarice, do me a favor. Let's just figure out what does on average it look like if somebody were to really, just stick with us through a year of just, getting testing done, paying supplements. And so this is pretty close to what things look like in our office. Because when we get testing done and we evaluate it, I would say on average, most people at an acute aspect are going to be under watchful care for about 6 to 8 months. And then it kind of tapers a little bit as we're teaching them within our culture how to do health differently and not need to be under such massive supervision. So basically for about 9 months to 12 months of care, consult wise, you're going to look at $1,850 to $2,500. Restoration versus manipulation. Testing anywhere from $300 to $1,300. This is probably more $750 to $1,300 if you're in that 3 to 5 different tests. I like to space them up a little bit. Dr. James and Jesse does too, because sometimes things just aren't necessary in the beginning. We want to kind of clean some things up first. You're going to spend on average between $200 to $450 a month on supplements. But again, if you don't get sassy and do the right things, that will diminish, and then we can show you how to just eat right. I mean, there are some things you'll just want to do on a regular basis, but then some of that just depends on your case. So in a year's worth of time, you're looking $5,000 to $7,000. Add in a little adjustment care in there, and I think, again, restoration, manipulation. Where do you think people complain more? Because they think, oh, this is science. Because it costs so much and it's so into the medical aspect, which, trust me, I'm glad they can do this. I mean, I'm thrilled to death that people that have tried everything now have kids and they're happy. I mean, I am truly grateful for that. And we're going to get into that a little bit more here shortly. But then I think restoration. Most of us have paid a lot of money to be in the situation we're in. We've all made ourselves sick by what we eat, what we do, how we stress. Even when we're trying to do the right things, we can take it to the next level and even show you that if you eat all organic, you can still be making yourself organically sick. I was a prime example of that. Dr. Jesse was a prime example, and James. So all of that, I think I like to just see the comparison. Again, we're about restoration. The medical is all about manipulation. And manipulation costs a lot more. And it costs more than your back pocket. It can cost you your physiology. So obviously, causes of infertility. And again, not just infertility. I mean, it could be diabetes, cancer. It can be prostate issues. There's been an interruption somewhere in the hormone process. There may be metabolic issues, gut issues. I mean, we see a lot of that, particularly in men. We just get used to eating the same things all the time. And that lack of variety can be pretty detrimental to our systems. So how do we treat a lot of these conditions, whether it's infertility, diabetes, or cancer? It's like throwing poop on the wall and seeing what sticks, right? Well, oh, that drug didn't work. Here, try this one. Oh, well, those symptoms got a little worse. Here, try this one. Let's see if we can make those symptoms go away. Nothing really to change the environment, improve normal function. So throw up this picture. We talked about pink ribbons. You know, this is really where I probably get a little more ramped up and emotional because I really don't know how else to put it other than we're mutilating our women today. I mean, this is, and I think Dr. Jessie, I see her shaking her head back there. It's exactly what it is, you know, all out of fear. And, you know, when I think identity, I mean, we talk a lot about personal growth and development in here with our clients, you know, again, do breasts define a woman? I mean, when we look at male, female parts, yes. Is that who they are? No. But I've yet to meet a woman that would be like, yeah, just take them. It's like, it's not going to affect anything. I mean, you're giving up a piece or pieces of yourself. And so, you know, I feel like my job is to share with each woman, what can you do to make sure you keep all your body parts? Because I ask everyone, how many body parts do you have to cut out or cut off till normal is achieved? You know, well, what if it's an ear infection? What do? Tubes. If you're still dealing with that, cut out your tonsils. Oh, you got appendicitis. Cut it out. I'm like, well, it's there for a reason, right? So what do we need to do to make sure we instill normal function? And so there's ways to test ahead of time to go, okay, what does that potential cancer pathway look like? This is a Dutch test. It's a urine test. So it's looking at how your liver is dealing with hormones and how they're metabolizing them. So in particular, this pathway of estrogen production lends itself to be a little more detrimental to DNA damage or cell damage. So if this gets really high or imbalanced compared to this estrogen, that can increase your risk to get breast or urine cancer. Now, other factors that go into that are what are your level of inflammation? What are, you know, what's your immune system like? Because I've seen unhealthy pathways have no detrimental issues because their immune system's in top notch. So we take all of those factors into consideration. Because this is the picture I hate the most out of this whole presentation. This is a chemotherapy room. And it literally is my goal in life that I hope every single one of those never get filled again. Because unfortunately, those rooms are filled way more than these rooms. Because everybody waits till it's almost too late. And it really does break my heart to see and watch what people go through when it comes to chemotherapy. I know some of you who are watching, you've already been through this. Okay? We have people in the audience tonight who've been through that. And they wish they would have known about the wellness way. Because trust me, a seat at this table is way better than a seat at that table. Because here they manipulate and annihilate your immune system in response. Here we figure out how you got off track and how to rebuild and how to restore normal again, because that's how the body was made. Because again, how many body parts need to be cut out for normal to be achieved? Hopefully no more. Because these are not the kind of parties I want to go to. I've seen pictures of cakes of bad booby parties, bad uterus parties. I'm glad there's probably other parts that they don't have cakes on. But I want to go to health parties. I want to go where people are celebrating normal function and restoration. You know, I want to be well into my 60s and 70s, still not taking drugs, hopefully being told I still look like I'm in my 40s or maybe 30s. You know, I don't want to get old and decrepit and laid up. You know, just take me then. So when it comes to hormone production, and we're favoring the ladies tonight, but you know, you're going to be in the ovaries, adrenal glands, and fat tissue. That's where the majority of your hormones are going to be produced. Same with the men. Testes, we can say that. Adrenal glands as we get older, and a little bit of some fat tissue as well. and old menopause. It's definitely not just puberty's evil older sister. But that's how we look at things these days. It's just like, again, common is normal. And when it's, things are working right, you should be able to transition into menopause without the hot flashes, without the weight gain, without the mood swings. And now the common thing is that when you move into menopause, it's hormone replacement. It's like your body quits making it, which is not true, just doesn't make as much. You're not trying to make a baby anymore. So, but I don't know about you ladies, but I'm pretty sure if you really knew where Premarin came from, you really wouldn't want it in your body. You ever wondered where they came up with the name? A pregnant mare urine. 3 words all mixed into one. I do not want horse urine in my body. So let's figure out how to keep your body parts, and let's figure out how to maximize that performance so that you can use what you've been given to be normal. So I think you guys can agree it's time to make a change. Let's do something different. So now we're going to get into kind of the nitty-gritty of what makes the Wellness Way different. Because I like this. We have a crazy idea that the body doesn't make mistakes, that it was designed to express normal. That is our normal genetic expression. So in here, you're not going to hear us say, oh, my genes are just, I got a bad rap. I'm going to say, no, your genes were designed to express normal. If you have trauma, toxins, and thoughts that are very stressful, and you alter the environment, your body's going to adapt, and your genes, they will then express the change that takes place. So if you're deficient, that's going to alter how genes do their job. So we like analogies. This is one of my favorite analogies. You'll get to hear it again. I think you heard it last time. But we look at health a little differently, as you guys know. And it's very important that we have our 2 systems. Like, we need the medical doctors, and we need, clinicians that think a little more like the Wellness Way, because I'm not equipped to handle emergencies. And so that's what this analogy is about. So if we call it the fireman and carpenter principle. So if we go home tonight, you go to your house and you come down the street and it's ablaze. Who would you call? Not Ghostbusters, because I know that's what our generation would say. But would you call your dentist? That'd be dumb, right? Like, he doesn't have the right tools and he doesn't have the right education. You're right. We would call the fire department because they have the right tools and the right education. All right. So that's what I really want you to listen and hear, is they have the right tools and the right education to come efficiently put out that fire as quickly as possible. Because the sooner they get it out, the more that house they can salvage and not have to completely, mow it down and start fresh. So then once the fire's out, we bring in the carpenter because they have the right tools and the right education to fix that. But here's what's crazy. So what does the fire department need? A hose and an axe to get in there and put out the fire. So they come in right away. They kick the doors down, break the windows. They're spraying everything down, your beautiful pictures, your couches, all these personal items. And in 15 minutes, the fire's out. And then we're standing in the background grateful, right? Patting them on the back going, yeah, you did it, Mr. Fireman. You put out that fire. But what happened to your house in the meantime? It's damaged. Man, you got water everywhere. Some stuff went up in smoke, some burned up. But they got the fire out. They did their job. Now it's time. We bring the carpenter in. He assesses what's going on and goes, yeah, I got a mess, but we can salvage this. We're going to bring these bits and pieces in to redo it. And then we can begin restoration. And it's not that either one of them are wrong. It's just they're both necessary for whatever's going on. So again, we're not going to call the fire department if we need carpentry work. Unfortunately, that's what we do too much. So if we were to kind of bring that analogy to the forefront of the medical system and what we do. So the fire department are the medical doctors, all right? So if you were to have a heart attack and a stroke, you wouldn't call me, right? I don't have the tools or the education to save your life. So we're going to call 911, the emergency doctors, and they're going to give you drugs, open you up, make sure there's no brain bleeds, and keep you alive. But the drugs and the surgeries, could they harm you? Yeah. How do we know? Well, the drug companies say they do. So they might save your life, but they're not good for you. And again, that's where most people make the big mistake. When it's all said and done, let's say you have a heart attack, does the doctor sit down and go, Mr. Jones, here's why you had a heart attack, and here's how we're going to help you not let this happen again? I've yet to hear that ever happen. They usually say, you're going to take these drugs for the rest of your life. You know what that's like? That's like me standing outside the house with my hose going, well, fire's never coming back. I'm going to keep spraying it down. What happens to the wood? It rots. What happens to the drywall? It gets moldy. Everything ruins. So the fire didn't come back, but the house rots with it. So that's where we come in as the carpenters. It's like, all right, here's why this happened. Let's make a plan to make sure this doesn't happen again. But unfortunately, when the fire is too bad or the drugs were administered, they can create some permanent damage. So we're trying to make sure people don't let their house get on fire, but I want them to know if it does get on fire, there are two scenarios that can be played out. So we do need both, because I'm not an emergency doctor. I'm a carpenter. Dr. James is a carpenter. Dr. Jesse's a carpenter. So that's what we call the fireman and carpenter approach. And I really think if we would approach help this way, it would drastically change the way people do things going forward. Hopefully be a little more proactive, so that we can continue to adapt the right way with our bodies. One final analogy I want to give you is how we view the body. So if you guys were, had a watch and took off the back, you can see there's all kinds of gears in there. And you got small ones, big ones, fast ones, slow ones. But if a little tooth were to break, how well would that watch keep its time? Not very efficient at all. So we, as carpenters, we look at the body as that Swiss watch principle. We want to see which gear has the most stress. And sometimes that can be a little challenging. So if I were to come over and step on your toe, did you know that that would make your heart rate go up and control your heart? Awesome. Most people don't. They think if that stays up, if I don't get off your toe, more than likely the heart rate's going to stay up and the blood pressure is going to go up, right? But if I go to the doctor, I can just get some drugs and make that go down, right? Yeah. Could the drugs harm you? Yep. Can the blood pressure kill you? Yes. You can even take natural things and get that to come down. But wouldn't it just make more sense to get off your toe? That's what I'm just asking people, like, let's figure out how to get off the toe. That's what happens. So now what's crazy is anybody ever heard of somebody complaining of chest pain, thinking they're having a heart attack, only to go find out through thousands of dollars of tests, like, nope, heart's fine, everything's good, you just had some heartburn. But see, that one gear, say on the digestive system, can create enough stress to make it feel like your heart's an issue, or affect your mental game, or infect your skin, or affect your immune system. So again, the idea is to find out where are things stressed the most, remove that stress. So again, every gear then can work together. And again, just like in the medical field, we have specialties. Like if you're going to have a foot surgery, you don't want to show up and the brain surgeon show up. You want the foot guy to show up. So I say it's time, when it comes to hormones, let's get our normal bodies back on track, okay? So 3 things I want to kind of close with, because most people always want to know, well, again, how do these stressors happen? We talked a little bit in the beginning about birth. So trauma, whether it's birth, car accidents, sports, trips and falls. I mean, I've literally asked people, have you ever been in a car accident? Nope. But I took a 4-wheeler over a cliff. Does that count? Yes. People run into trees, slip on the ice. I mean, you name it. There's just things we don't always associate to an interruption in normal function. Toxins, all right, that can be, excuse me, anywhere from what we're breathing, what we're drinking, what's in our food, what's in the environment, and the carpets, the walls, the paints, all those things. And stress. You think we're stressed out this year at all? Probably more than ever in the last 10 years. 2020 has been rough. So what are some things that you can do to maybe change your course of action tonight when it comes to health? Get adjusted. It's one of the best ways to restore normal nerve flow to the body. We get checked all the time in here, we don't always need an adjustment, but we get checked often. So things to be aware of that interfere chemically. We got pesticides, birth control we talked about, all kinds of plastic stuff, cookware, heavy metals. I mean, when people buy houses, they get radon testing done. They get all these different things trying to make sure they're not putting abnormal chemicals in their body. And one of the ways you do that is test. So one of the mottos we used to have at the Wellness Way was we don't guess, we test. So we look at that with X-ray and MRI. We can do that with food allergies, stool test, heavy metals. And there's a lot of different ways to gauge your physiology. And then I'll leave you with this. This is one of my favorite little scenes from Shawshank Redemption. When he finally gets out, it says, get busy living or get busy dying. And I honestly see people dying every day. Maybe not immediately in front of me, but I see them on the path where they are literally dying a little bit every day. And that's why I love getting to be in front of people on a regular basis, sharing the Wellness Way story, because I hope tonight you choose to get busy living. And I hope that we've given you some information that's kind of challenged what you've always done. And I hope tonight you can literally mark on your calendar that November 17th, 2020 was the night I decided to change course and get on the path to restoration. Because unfortunately, many of us have been on the path to manipulation and deterioration. And even I think yesterday I put out on some Facebook stuff, you get what you tolerate, and I'm hoping tonight you are done tolerating dysfunction and just being stuck. And so we've really made it pretty easy for you to take the next step. If this is something that is resonating with you and you're ready to really go deep and find out some more information, there's a link that'll show up in the chat on the webinar where you guys can set up discovery calls with Dr. Jessica, with Dr. James, even with myself. We've opened up some spaces for you guys to just have a 10-minute conversation. Let's get to know each other. Let's connect and figure out if this is going to be a good fit for you and taking the next steps going forward. So if that's something that you'd like to do, again, that'll be in the chat and you can set that up directly into our schedule. And a couple things that I would ask of you guys when we're done tonight, and everything goes okay technology-wise, we'll go ahead and send the recording to you. And all I ask is send it to somebody who didn't make it tonight, because somebody needs to hear this message big time. Because people are getting sicker and sicker, whether it's infertility, cancer, diabetes, you name it. There's a better way. It's called the Wellness Way. So I appreciate your time tonight. Check in on a regular basis. We usually do these every month. Sometimes we repeat the hormones. Sometimes we do inflammation. Sometimes we do immune. So we're always doing something to bring new information to you guys. And so again, I appreciate your time tonight and look forward to connecting. Thank you guys for coming.
We actually have a question for you.
Oh, okay. I'll turn my mic back.
I was asking about bioidentical hormones and you were talking about hormone replacements and everything.
Yep.
Do you have any take on that?
So if you've had your uterus and ovaries removed, you will have to do some type of bioidentical, whether it's, we actually have had pretty good success just using the organ meats. So we do a lot of the beef adrenals, female organ meats, so glandulars, that's the word I was looking for. But here's the scary part. So we've seen a lot of women recently who are doing bioidenticals, but still have their ovaries and uterus. So you still have the ability to make hormone, yet they're giving it to you because your levels are low. And when we've done our proper testing, we've found that actually the bioidenticals were pushing these females into breast or uterine cancers because that one marker, let's go back to right here. So I have had menopausal women. So here, you probably can't see it back there, but this purple is where a menopausal lady should be. So if they're on those bioidenticals, I've seen them completely pegged out way beyond where they should be. And if they stay there with other factors of inflammation, stress, and a weak immune response, that's going to be a bad day. Good question. So that's definitely something that we can go a little deeper with them and get them on a better path. Any other questions?
That's all that I had in there.
All right.
Except for that you put 2
I look like Hugh Jackman? That's pretty cool. Was that a comment? Hey, wasn't I singing his songs tonight
That's
before
what I
the?
called you our greatest showman.
Yeah, the greatest showman. All right. Well, we'll end there. So I appreciate your responses and questions. And again, we'll look forward to connecting with you guys.